Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're focusing on diverticular disease, a condition where small pouches called diverticula form in the wall of the colon. Many people have these pouches without symptoms, but when they become inflamed or infected, it can cause significant abdominal pain, bleeding, or even serious complication. Joining me today to explain what it is, why it happens, and how we treat it is my colleague, Dr. Bryn Henderson, a board certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here today.
Thank you for having me. It's my privilege.
All right, what is diverticular disease?
Diverticular disease means there are small outpouches in the colon. When they are just present, they're not inflamed. We call it diverticulosis. That means they swell or get infected, and that's called diverticulitis, a medical emergency. Symptoms can range from no discomfort to severe abdominal pain, fever, or complications like bleeding, abscesses, and obstruction.
Okay, so let's talk about the different types or stages.
We describe it in three main ways. Diverticulosis, where the pouches are present, but there's no symptoms. Uncomplicated diverticulitis, where they're inflamed and causing pain, but without major complications. And then complicated diverticulitis, which is more severe with abscesses, perforation, obstruction, or fistulas. These are the medical emergencies. Doctors also use staging systems like the PENSANTI classification, which is universally accepted staging system for acute complicated diverticulitis, categorizing the severity of the disease and its complication. I worked in emergency rooms for over 30 years, off and on for decades, and you have to be able to describe the severity, not only for the patients, but to the surgeon you call to get help quick.
All right, so what causes diverticular disease in the first place?
Good question. The main drivers are diet and lifestyle. A low fiber diet, obesity, or lack of exercise, they all raise the risk. Age also matters. As the colon wall weakens over time, the muscles along that wall separate, and it's very easy for their outpouches to begin in certain locations. Medications like steroids, non-steroidals can increase your risk too because it decreases the strength of those muscles. Genetics play a role as well, with twin studies showing an inheritability of up to 50%.
All right, you talked about this genetics playing a role.
Very much so. Studies in twins and families show a strong inherited component. Certain connective tissue disorders like Marfan and Ehlers-Danlos increase risk. The genome-wide studies have linked genes related to connective tissue. Immune functions decrease, and smooth muscle, that's what we just talked about, is linked to the diverticular disease. Family history clearly raises that likelihood.
So, if family history does it, what are the birth factors in development?
Diverticular disease is considered an acquired condition, but the embryological shapes, like the colon's architecture and other things, are examples of something you're born with. For example, the blood vessels penetrate the colon wall at specific sites that are naturally weaker in some families, and those spots created during development often become the places where the diverticula form and later in life get inflamed.
So you talked about alcohol and smoking. Let's say a person is born with this predisposition for the weak spots in the colon. They're born with this predisposition to having diverticulosis, but then they smoke and they drink and they make it worse.
They really compound the damage there. The way traditional Chinese medicine address it, because of course it's not a balance. And when it's out of balance, then they figure out what needs to be improved. The diverticular disease is seen as a problem in pee stagnation and damp heat in the intestines. So acupuncture points help regulate bowel movement and reduce the inflammation. And the herbs they often give you are used to clear the heat and strengthen the digestion. It's often combined with modern era medications to help reduce relapses.
Well, how do you diagnose it in your office?
The gold standard is a CT scan of the abdomen. That, remember, is a little down the road. We can detect diverticulitis with high accuracy, but they're already in pain and they've already screwed up their diet or done whatever the trigger was. So we often use for early detection the ultrasound, which we have right in our office. The MRI can also be used, but again, it takes time to schedule those things, and that disease is progressing while you're waiting for the CAT scan or the MRI. Colonoscopy, which is looking inside, is used, but you can't do it on a hot colon. You're just going to aggravate it. So that's recommended after recovery to exclude the colon cancer or other factors that could be hiding underneath the diverticular disease. So the blood tests like C-reactive protein and SED rates all correlate with inflammation. You can even use scanners for inflammation. And we do that often to pick them up early.
All right. What's the standard of treatment in the United States of America today?
For uncomplicated diverticulitis, in other words, I just moved it out of surgery, then many patients can be treated at home with rest, fluids, and diet adjustments. A lot of fluids. Antibiotics are used selectively, and they're not used on everybody. But for complicated cases, we use antibiotics because sometimes there's infections in pockets. Those are called abscesses. And if you really find those, often you're going to surgery because you don't want to have a perforation and heaven help you if you got an obstruction, because you block that tube, that's a pretty big colon, and that's a medical emergency. Long-term prevention focuses on high fiber diet, regular exercise, weight control, and avoid smoking, please.
All right. Tell us about regenerative emerging therapies.
This is still early stages of this stuff, but it's very promising. Regenerative cells and exosomes are being studied for their ability to reduce inflammation and help repair the intestinal lining. It's pretty cool. These cells may one day be used to regenerate damaged bowel tissue as well. PRP, the platelet-rich plasma, and the peptides and amino acids are currently, we give anytime there's GI problems, we can give BPC 157 or something like that.
All right. Beyond medical treatments, what lifestyle strategies can you tell us to help patients?
Lifestyle makes a big difference, huge difference. Eat the high fiber diet with fruits, vegetables, legumes, and whole grains. Drink fluid galore, plenty of fluids until that urine's clear. Stay physically active. Don't have to be strong, but everything needs to work. Avoid smoking and very limited alcohol. Manage your stress, since the gut-brain connection can worsen symptoms. And I think we're well aware now that that gut can cause all kinds of diseases in our brains, from Parkinson's to your stroke susceptibility. Nuts and seeds, once thought to worsen diverticulitis, are now considered safe.
All right. So what's the long-term outlook?
Most patients with diverticulosis never develop complications. For those with diverticulitis, the majority recover, though about 20 to 35% have reoccurrences. So that's pretty high. Severe complications like perforation and obstruction are less common, but can be life-threatening. That's a medical emergency. Lifestyle adjustments and careful follow-up for most patients to have a favorable prognosis. We literally call them to make sure they're being good boys and good girls and following our recommendations.
Let's talk about the mnemonic for diverticular disease care.
The word's fiber that we use.
F stands for?
Fiber-rich diet.
I.
Identify the symptoms early. Pain, fever, and bowel changes.
B.
Build healthy habits, exercise, weight control, and plenty of sleep.
E.
Evaluate with imaging when needed.
R.
Regenerative research for future options are in the cards.
Well, thank you, Dr. Henderson, for taking us through diverticular disease, a condition that is often silent but can lead to serious problems if ignored. If you or someone you know has persistent abdominal pain or changes in bowel habits, don't wait. See your doctor and ask about evaluation for diverticular disease. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.